Okay, now for victim who is conscious, okay, where you don't need to do any CPR, we need to assess the victim in terms of treating his level of consciousness, the adequacy of his breathing, and if there's any bleeding, if you remember this diagram. Now, in terms of level of consciousness, the victim can appear to be conscious, but he's not aware of the surrounding, he's a bit groggy or dizzy. We may have to make a note that if that's happened, in medical term, we say that his GCS is low, meaning that there's already an insult, an ischemic insult to the brain. Next thing, when we evaluate the breathing, we'll try to look his breathing pattern, whether his breathing is normal or he's breathing very fast and shallow. Breathing very fast and shallow is also another sign, what we call as tachypnea, a sign to say that there could be an insult to the respiratory system. And as you can see, bleeding, if he jump or fall into the water and hit his head against the rock or hit his body against something, he might bleed. So again, these three important things: level of consciousness, adequacy of breathing, and presence of bleeding is important for you to evaluate. Now, all of these victims need oxygen, so oxygen therapy should be given to all near drowning victims. Okay. Now, if the victim is breathing on his or her own, you can give oxygen through a face mask, or better still, a high flow mask or non-dribbling face mask. However, in a non-breathing patient, okay, now you might even need to do a manual back mask ventilations and even intubating him. But let this second one, let this basically be done by the paramedics who are trained to do this. Now, what if you don't have oxygen? It's okay. If you don't have oxygen, you can still help the patient, give him air to breathe, clear the space. Okay, let him, if there's any crowd, make sure the crowd is not overcrowding him, and let him breathe easily. Okay, you can even use the triangular bandage or anything, just try to fan him. This will help his breathing, but not too fast because you don't want to induce hypothermia. Now, the next thing in a near drowning victim is to keep warm. Okay, once you get the patient onto the shore, or basically by the side of the pool, remove the wet clothing. Okay, because wet clothing will cause his temperature, his body temperature, to drop. So removal of wet clothing is an important thing. Give him dry, warm blankets if possible, or dry clothing. Now, if you don't have any of these things, basically hugging the victim also can improve in terms of keeping the victim warm. IV access or intravenous access is not really necessary. If it to be done, let it be done by a trained paramedic. For layperson, you will not be able to do this. But the important thing you need to do here is to keep the victim close, keep a close watch to the victim, keep monitoring the victim, make sure he's still conscious all the time, talk to him or her basically, and keep on checking his vital signs and re-evaluate it regularly. Alright, the vital sign, when I mention vital sign, is basically his respiratory rate, his pulse rate, his level of consciousness, and if you have a blood pressure monitoring, you can do that. If not, that's fine. And also his temperature. So you need to keep on doing this thing, re-evaluation at the regular intervals, maybe every 10 to 15 minutes for the victim. Now, do we need to transfer all near drowning victims to the hospital? Well, if the victim have these signs and symptoms, then I think it is better for you to transfer the victim to the hospitals. One is amnesia. If there's any period of amnesia, then it's best to bring him to the hospital. 2, there is loss or depressed level of consciousness. He appeared conscious, but he's drowsy, he's groggy. Now, these are the signs that he have the asphyxia has insulted the brain, so we need to get him to the hospital as soon as possible. Now, if there's any period of apnea, apnea means no breathing. Okay, he has stopped breathing for any period of time, 1 minute, 2 minutes, or whatsoever. Then after your resuscitation, he basically appeared to be conscious again. That kind of victim, you need to bring him to the hospital. Or any victim that require artificial ventilation at any moment, meaning that you need to give him back mask ventilation, then this victim need to be brought to the hospital. So these are the 4 criteria that you need to bring the victim to the hospital as soon as possible. And if they have any of these 4, but when you engage with the victim later, you noted that the victim has appeared normal or no symptoms, but if you have any of these signs, any of these 4 signs, you still bring him to the hospital for a further checkup. So in summary, the management of near drowning victim at the pool or at the pre-hospital site is actually you have to move in rapidly, but you have to be cautious in your rescue efforts. If you suspect there is a diving injuries, you need to basically protect the spine. You have to be very careful. You need to do CPR if he has a cardiac arrest or he stopped breathing, and give oxygen to all of this victim, especially those who have insult to the brain and also to the lung. And last but not least, remember the 4 criteria for you to transport the victim immediately. But if it doesn't have any of the 4 criteria, if you have any doubt, then you also it's best for you to send the victim to the hospital for further evaluation. Thank you.